Greetings, everyone. My name is Vidisha Vaidya, and I'm a diagnostic radiologist from Western Australia. I work at SKG Radiology. Thank you for the kind invitation to contribute on this platform. I have the pleasure and privilege of having multiple volunteering roles within the college and more locally within Western Australia. In the college, I serve as one of the two co-conveners for the Centralized Learning Program, which provides recorded educational material for all RANZCR members, but particularly for RANZCR trainees who are preparing for their phase 2 examinations, and the content of these lectures is mapped to the RANZCR curriculum. I also have a passion for pathology teaching, and with that in mind, I serve as a panel member on the phase 2 pathology examinations team for RANZCR. I also serve as a clinical assessor in the RANZCR accreditation team. In Perth, WA, I have the pleasure of serving as the Director of Medical Education for Clinical Radiology at SKG Radiology, and also the RANZCR appointed Director of Training. Both these roles go hand in hand, and I provide education to radiology registrars as well as medical students from the University of Notre Dame in WA. With regards to my Director of Medical Education role, I construct and coordinate and implement trial radiology case reporting and OSCAR examinations for our WA trainees. And I also have the pleasure and privilege of serving as a member on the Radiological Council of Western Australia, which serves to maintain the highest possible standards for community safety and safe use of radiological equipment. In terms of what inspired me to take on these roles, I would have to say my late father, who used to be a medical practitioner in Zimbabwe, in Southern Africa, and he used to do community outreach programs in his spare time, which included education of other healthcare professionals. My own personal interest in education and volunteering has been as long as the last 2 decades, and it brings me a great deal of joy and a sense of purpose to contribute, be it in education or be it in terms of giving of my time to accreditation-related activities, which helps us maintain high standards for training and education for our RANZCR members. A particular issue that I'm extremely passionate about advocating for is supporting our country patients dealing with cancer. With that in mind, about 3 to 4 years ago, we set up a small donation process for Cancer Council WA, whereby all WA trainees who attend our trial examinations at SKG make a small nominal donation directly to Cancer Council WA. 100% of proceeds go directly to Cancer Council WA, and in turn, they benefit country patients who require accommodation whilst they traverse their cancer care in Perth CBD. And the way it works on the shop floor is that we have adopted a room in a place called Milroy Lodge in Perth, WA, which provides free of cost accommodation to country patients and their families. It's very rewarding and indeed very moving to see what an impact it has at a practical and personal level in the lives of patients from the country who are dealing with cancer and the various medical care related appointments. In my experience, volunteering is a very rewarding activity to engage in, and it benefits both the college and the wider profession in a multitude of ways. Firstly, at a more zoomed out level, it creates a culture of giving back and leaving any place or any professional environment better than we find it. Secondly, It is wonderful to have the opportunity to contribute and make a difference and shape policy, be it in education, be it in examinations and assessment, or be it in other decision-making roles, both within the college at a national and a state-based level. I also think that volunteering enables you to promote or enables one to promote a sense of diversity in the decision-making process. The diversity could be jurisdictional, could be gender-based, could be cultural-based, and beyond. And finally, I think it enables the community, both within RANZCR and outside, to see us as more than just our relatively narrow impression of our professional roles, which is that of a diagnostic radiologist or a clinical radiologist. It enables them, the community, to see various facets of what we do, who we are, and the things we feel passionate about. The advice I would give members who might consider getting involved and volunteering within the college is to encourage them to do so from two perspectives. One is, by volunteering, we get to give back to the profession, which I believe has given us so much. And secondly, to be in a position where we contribute to decision making, to shaping how our college is being run, and how we train, educate, and assess radiology doctors in training of the future.